feel like we've been talking a lot about thyroid function this week, so I thought I would share what is hopefully a simple explanation of the way that our thyroid should be working and the function that it has in our body. So here in our diagram, you can see at the very bottom there is a cell. It can be any of the cells in our body, and it has a receptor that is waiting for messages from our thyroid to act. So it's responsible for things like our metabolism. So it increases our ability to burn through our energy, our stored energy. It controls things like our gut motility, so whether or not our bowels are moving quickly or slowly. It has a lot to do with our temperature regulation in our body. There's lots of things that the thyroid controls. And so ultimately, that cell is waiting for a message to get to it to activate and for it to perform its function. So if we start now from the top of the diagram, you'll see here that a message comes from above, and that's coming from our brain, and the message comes in the form of TSH, and you might have seen this in your blood tests. When we have a reading that is high, that is what we would call the condition hypothyroidism. And that is like the message from the brain getting louder and louder as that number goes up. It's trying to communicate with what I've drawn there as a butterfly, but it is our butterfly-shaped organ, which is the thyroid. So that message is getting louder and louder from the brain. The TSH number is going up and up, saying, produce more T4 and T3 because the cell is waiting for action. Now, that number continues to go up and up. So then some people will go ahead and take medicine for low thyroid function, and that medicine is T4, but otherwise our thyroid would be producing that T4. Now the T4 itself is not in a form that can act on the cell, so it gets converted into T3. Now this is the really interesting thing that I have seen quite a bit recently for people who have been taking T4, levothyroxine or thyroxine or L-troxin for a very long time, that their TSH numbers are looking okay, their T4 numbers are looking okay, but they're still having all the symptoms that they ever had when it comes to their thyroid function. And that's because the T4 is not converting well to the T3, but rather it converts to something called the RT3. That's reverse T3. So if we were to think of our T3 as a hand, the reverse T3 is simply that same molecule but in the reverse form. When it gets down to the cell though, it stops the activity that is supposed to happen. It's not triggering, it's not switching on that cell to do anything. And so we're treating up there at T4, which is not actually acting on the cell, and instead of going down to T3 and then doing its job in the cell, it's actually going down this second path, the RT3. So what would stop that conversion? Well, if there's not enough cofactors, and what are they? They're all the different minerals that we need in order for that to happen, or more broadly, we are carrying heavy metals, we are experiencing high stress, we have infection in our body. There's a lot of things that can cause that pathway to go down the wrong side there. Now, in your blood test, if you go back and have a look, your TSH level is probably there, and perhaps your T4 level has been measured, but many times the T3 and especially the RT3 are not measured. They're not covered by Medicare in Australia, and so you would need to seek out specifically to get those measured. But really, that's the key point if you want to know whether or not your thyroid is producing enough T4 or your medicine that you're taking as T4 is really making a difference to what it's supposed to do. So in a nutshell, that's what our thyroid's supposed to be doing, but recently I'm seeing a lot of thyroids that aren't behaving in that way, and I think there's a few things that we can definitely do to help that process. Looking at infection, looking at heavy metal detoxification, looking at stress management, and making sure we have all the nutrients that we need for that to work well.